Listen, for the past 2 months, Texans have forged a bond of unity and trust. We've worked together for a cause far greater than ourselves. Millions of Texans have sacrificed their livelihoods as well as so many of their cherished moments in an unprecedented effort to prioritize the health and safety of our fellow Texans. It's been a collective effort to slow the spread of COVID-19. Well, because of your efforts, the COVID-19 infection rate has been on the decline over the past 17 days. Because of your efforts, and especially the work of our doctors and nurses and all healthcare providers, our hospitalization rate has held steady, and our hospital capacity has remained abundant. At the same time, we must not forget those who have lost their lives because of COVID-19. Our hearts will remain with their families and their loved ones. Every life lost is a tragedy. But the fact is, the tragedies in Texas have been far fewer than in most states in the United States. And I'm proud to say that Texas has the third most recoveries from COVID-19 in America. In fact, the number of people who have recovered from COVID-19 will soon exceed the number of active cases. The lives saved are priceless, but the price has been steep. Many have lost jobs. Others have lost businesses. Many are struggling to pay their bills. I want those Texans to know they are not alone in this fight. Just as we united as one state to slow COVID-19, we must also come together to begin rebuilding the lives and the livelihoods of our fellow Texans. Well, since March, we've been laying the groundwork to reopen Texas. We ensured additional hospital facilities were available to meet the needs of COVID-19 patients. We stocked up on PPE supplies like masks. We closed schools to slow the coronavirus spread. We even required travelers from other states to self-quarantine to reduce importing COVID-19 into Texas. And we also reduced large gatherings of people to better slow the spread of the coronavirus. Also, I deployed more than 3,000 Texas National Guard. They will be operating 25 mobile COVID testing sites across Texas, as well as 3 fixed testing sites in Houston, Huntsville, and Kingsville. They are operating 9 PPE distribution sites, and they deployed a team that manufactures more than 500,000 N95 masks each day. They've already made more than 6 million of those masks. And they're also helping Texas families. They've deployed almost 1,000 National Guard to prepare and serve meals at food banks across our state. Now, we also are working for those who are filing unemployment claims. We have provided the Texas Workforce Commission with desperately needed help to respond to the record-breaking unemployment claims that have been filed, with new hires, as well as volunteers that have been offered up by both the Texas House and the Texas Senate, as well as from state agencies. We have more than tripled the Texas Workforce Commission staff to more than 2,000. More than 1.9 million claims have been filed, but now more than 1.6 million have been processed, and over $2 billion has been paid out in unemployment benefits. Now, our goal, of course, is to get those Texans back to work, and that is what today is all about. My executive order to stay at home that was issued last month is set to expire on April the 30th. That executive order has done its job to slow the growth of COVID-19, and I will let it expire as scheduled. Now it's time to set a new course, a course that responsibly opens up business in Texas. We will open in a way that uses safe standards for businesses, for their employees, as well as for their customers. Standards based upon data and on doctors. I want to thank the Strike Force team led by James Huffines, working with a board of advisors and consulting with doctors to hone best practices that allow as many businesses as possible to open in ways that contain the spread of COVID-19. I also want to thank the Lieutenant Governor and the Speaker, as well as all of our legislators. And I especially want to thank our team of medical professionals who have spent countless hours providing input about the safest ways that businesses can operate. That team includes Dr. Hellerstedt, the Commissioner of the Department of State Health Services. It includes Dr. McClellan, a former head of the FDA and the former head of Medicaid and Medicare for the United States. It includes Dr. Hudson, and an infectious disease specialist who's also the director of testing and tracing COVID-19 at the University of Texas Dell Medical School. And it includes Dr. Zerwas, the Executive Vice Chancellor for Health Affairs at the University of Texas System. Additionally, I remain in regular contact with Dr. Birx as well as with the CDC. And we will continue to depend upon these experts as we move forward to safely open Texas for business. There's a reason that all businesses in Texas cannot open all at once. We've already seen precautionary tales of what can happen when things reopen. There have been reports that China is now having new outbreaks. Singapore is having a second wave that's bigger than its first wave. There's coronavirus expansion in places like Hong Kong and Japan. The deal is, it's a fact. It's hard to get rid of this virus because it is so contagious. So we're not just going to open up and hope for the best. Instead, we will put measures in place that will help businesses open while also containing the virus and keeping Texans safe. Now, I said 10 days ago, opening Texas must occur in phases. Obviously, not all businesses can open all at once. A more strategic approach is required to ensure that we don't reopen only to have to close down again. So, consistent with CDC guidelines and based on advice from infectious disease specialists, we will open Texas businesses in phases. Phase 1 begins this Friday, May 1st. If we can contain the spread of COVID-19 during that time period, we can move to Phase 2 as early as May the 18th. Phase 2 will open more businesses and allow the businesses open in Phase 1 to expand their operations. We need to see 2 weeks of data to confirm no flare-up of COVID-19. That is exactly why now more than ever Texans must continue safe distancing practices. If we do that, we will be able to expand into Phase 2, opening up our economy even more. Well, as we go into Phase 1, the most important element of Phase 1 is protecting our most vulnerable Texans. People age 65 and over represent just over 20% of the Texans who test positive for COVID-19. But more than 75% of deaths were people 65 and older. Here's the point. If we redouble our efforts to protect our most vulnerable senior citizens, we can reduce COVID-19 deaths while also expanding business operations and increasing the number of Texans reentering the workforce. To achieve these goals, Phase 1 does several things. It emphasizes the importance of vulnerable populations remaining at home if at all possible. If they need to get out, businesses should make special accommodations to limit the exposure that our vulnerable population has to people who may have COVID-19. We will also redouble our efforts to protect seniors in nursing homes and other senior living facilities. That includes things like better infectious disease protocols at senior living centers. The bottom line is this: the more we do to protect our vulnerable senior population, the faster we can safely open business in Texas. Next is a list of the businesses that can open safely on May the 1st. Now, once again, the ultimate decision about the types of businesses and the extent to which they can open was driven by the doctors advising us about safe medical practices. Those doctors also prescribed health guidelines for businesses, for employees, and for customers. Those protocols focus on minimizing the spread of COVID-19. They are contained in this book that can also be found at gov.texas.gov/OpenTexas. So with my new executive order, all retail stores, restaurants, movie theaters, and malls can reopen May the 1st. Now, to minimize the spread of COVID-19 during Phase 1, on the advice of doctors, I am limiting occupancy to no more than 25%. This is a proven business strategy. It's exactly the type of practice successfully used by H-E-B and Home Depot. The extent to which this order opens up businesses in Texas supersedes all local orders. If Phase 1 works while containing COVID-19, Phase 2 will expand that occupancy to 50%. Further increases will be allowed in the future so long as COVID-19 remains contained. Something important to remember: this order allows these businesses to reopen. It does not require them to do so. If a business owner feels unsafe opening at this time, or for other reasons doesn't want to reopen, there's no requirement to do so. Additionally, all museums and libraries can open under the same 25% capacity. However, interactive areas of museums with hands-on exhibits must remain closed at this time. And again, this is permission to open, not a requirement. Some libraries and museums are operated privately or by local governments or universities. It's up to them to decide if they are able to open. The state will work to open its libraries and museums by May 1 or soon thereafter. Now, a lot of business in Texas is done by sole proprietors. They can safely return to work now. The guidance in this book and online provides safe standards for sole practitioners. Also, churches and places of worship, they were kept open under the existing executive order. But effective May the 1st, they will be able to expand their capacity even more. We do, however, emphasize the importance of safe distancing practices to ensure that church members remain protected from COVID-19. Outdoor sports are also allowed at this time, so long, however, as it involves no more than 4 participants playing together at any one particular time, and so long as certain distancing practices are followed. Examples of this would be things like golf and tennis. If COVID-19 can be contained in phase 1, the goal would be to expand the number of participants in phase 2 to allow even more sporting activities to be engaged in. Doctors, nurses, and dentists, they need to get back to work. But even more importantly, patients need to get in to see those doctors, nurses, and dentists. So, all licensed healthcare professionals are allowed to return to work with few restrictions. However, all licensed hospitals still must reserve 15% of capacity for COVID-19 patients. All of these things I've outlined are in addition to the many parts of our economy that never shut down. Our farmers and ranchers, grocery stores and drugstores and hardware stores, our home builders and realtors, manufacturers, construction workers, car dealers, banks, and gas stations all have continued to operate. Those and other essential services will be allowed to continue to operate as they have. Now, one thing we all know, Texas is a big state with a very diverse geography. The fact is, not all counties are alike, and not all counties are affected the same by COVID-19. As our medical team explained, even in low population counties, COVID-19 can still spread very rapidly. Moore County and Donnelly County are just 2 examples of that. So, to protect rural counties from the spread of COVID-19 and to prevent counties with little or no COVID-19 from being punished, a different standard can apply to counties with 5 or fewer cases of COVID-19. This would include almost half of the counties in the state of Texas. For those counties, they must comply with all of the safety standards outlined by the doctors, but for all business activities that have been limited to a 25% capacity, in the counties with 5 or fewer COVID-19 cases, they can increase their capacity to 50%. That said, as explained in this manual, there are still some conditions that must be met for the county to qualify. And note also, as explained in the manual, if there is an outbreak of COVID-19, it could cause a county to revert back to a more limited capacity. Now, there are some businesses that I want to open, that Texans want open, that the doctors advised were simply not safe enough to open at this particular time. They include barbershops and hair salons, bars and gyms. We are working with our medical team as well as working with members of the industry sectors to open these businesses as soon as possible. My hope is that they will open on or no later than mid-May. Now listen, we realize that an important part of reopening is access to child care. We have already established a robust child care program for essential workers. The Child Care Task Force is led by Elaine Mendoza. They developed an online site that connects workers with local child care. The site lists over 6,000 providers in over 1,000 zip codes in almost 200 counties across the state. Currently, there are more than 120,000 child care spots that are available for essential workers. Our goal is to find ways to expand those resources and make them available in a safe way to more workers across the entire state. We know how important this issue is to working families, and we're giving it the speedy attention that it deserves. The same applies to summer camps. We know how important they are for our kids and how important they are for parents. Our medical team is still working on safe ways that kids will be able to attend summer camps. We know that camps are trying to get ready to make announcements for plans sometime soon. So we will continue working as swiftly as possible on ways to open summer camps, knowing that safety of all kids at camps is the most important consideration. Now, a core part of opening up safely is having an effective testing and tracing process, a process that can quickly identify any flare-ups in COVID-19. We have already developed a robust testing and tracing program to help identify others who may have been infected. Phase 1 of our tracing program is already completed. It mobilized a team of more than 1,100 state and local contact tracers. It created a contact tracing IT application. It set up a COVID-19 contact tracing call center. Phase 2 of that program begins today. During the next 2 weeks, they will add another 1,000 tracers. They will deploy the contact tracing application statewide and deploy statewide the COVID-19 contact tracing call center. Phase 3 of the program will use the month of May to build a team of 4,000 contact tracers. Here's what the team does. They test for those who may be affected. They then help isolate those who test positive. Then they try to locate everyone who's been in contact with the infected person. And then they work with them to self-isolate for 14 days. What that process does is it will box in the expansion of COVID-19. This process will be bolstered by an increase in testing. When you aggregate all of the tests run by the state and local governments with the rapidly increasing number of tests run by the private sector, we should easily exceed our goal of 25,000 tests per day. Well, I had the opportunity to talk to Dr. Burks about this plan, and I sent her a copy of it. And she said the Texas plan was great. I want to join governors from across the country from both parties in thanking President Trump for all they have done to help our state. They truly have been available to us on a 24/7 basis. Now, safely opening Texas for business requires 4 things. 1, a commitment to continue safe distancing practices that reduce the spread of COVID-19. 2, reliance on doctors and data to provide the safest strategies. 3, a focus on protecting the most vulnerable from exposure to COVID-19. And 4, a reminder that it is entrepreneurs who drive the Texas economy. They need to be unleashed to restore livelihoods while all of us remain focused on protecting the lives of our fellow Texans. We are Texans. We got this.